We get going?
Yep.
It's 9 o'clock in the morning here in Plymouth, in the southwest of England. Good morning, good afternoon, good evening to you, wherever you are in the world. And welcome to this presentation from the Faculty of Health and the School of Health Professions, more specifically. So my colleagues will talk to you about the school itself and all the different degree programs on offer. And we'll also, on behalf of UPIC, describe to you the foundation programs which we have available, which lead into those degree programs. But we'll focus very much on the School of Health Professions, on the degrees, their content, and the careers they can lead into. Let's start with some introduction. So my name is Tim Gutzel. I'm Director of Marketing and Admissions for UPIC. Who else do we have from UPIC on the call? It's a bit hard for me to see at the moment. I think Matthias is there, aren't you?
I am Tim. Hello, everyone. My name is Matthias. I'm the college director and principal, and I think I see Jake on the call, so I'll hand over to Jake.
Yep, thank you, Matthias. My name is Jake, and I am one of the student experience officers here at UPIC. I believe that's everyone.
Thank you both. And then
And me.
Oh,
sorry,
Anita, sorry.
You forgot about me. Well, anyway,
could we
my
do
name is
that?
Anita. My name is Anita. I'm the student experience manager here at UPIC.
There you go. So that's for the UPIC team members who've joined us this morning. And then we have our colleagues from the university. Sue and Claire, would you like to introduce yourselves?
Yeah, hi everybody. My name's Sue May. I'm the Associate Head of School for Internationalisation for School of Health Professions. And that's just really important for you to know because it just means how important it is to us to really support our international students. And I'm also a physiotherapy lecturer as well.
Yeah, and I'm Claire. I'm the Associate Head of School for Marketing and Recruitment. So again, really pleased to be able to kind of talk to you about what we have to offer. Yeah, I'm also a physio by background, actually. So yeah.
Lovely, thanks all. So moving on through our slides.
Great. I'm going to start with this one. So, yeah, welcome everybody. We're so pleased to have this opportunity to be able to speak to you more about what the School of Health Professions can offer and how passionate we are about offering this opportunity to you. So you're here because you are interested in looking at a career in health professions. And what I wanted to start off with was just talk about how important it is. You know yourself that if you go and see a health professional, and it might be we're going to talk a little bit more about the programs that we offer on the next slide, but whoever that health professional might be, you're part of a much bigger team. And for us here at the university, that's really important. So that's why we're just sort of pointing out here that the School of Health Professions is part of the bigger Faculty of Health. So that's different people that we connect with and that you may well connect with as part of your degree program. It also means in my role as the sort of associate head of school, I'm really, my sort of key emphasis is on supporting our international recruitment and international students. That means we have a really sort of joined up thinking to really think about that student experience for all of our students, wherever they are coming from. Yeah, that's just a really important thing. It's important that you understand School of Health Professions is part of that Faculty of Health, a really vibrant and interactive faculty. Claire, over to you. Next slide, please, Tim.
Thank you, Sue. So yeah, as Sue mentioned, that we do have quite a lot of different professions, allied health professions within our school. And we feel that's a real strength of our school. There's lots of opportunities for interprofessional learning. So we have occupational therapy, optometry, paramedicine, podiatry, physiotherapy, social work, and dietetics and human nutrition as part of our offer within the school. So that means that, as I say, you would learn with other students on interprofessional modules. You also have opportunity to be taught by lecturers from other areas of the profession. And that's really key because when you do go out into healthcare practice, you will end up working with those professions for the benefit of patient outcomes. So it means that you will come out with a good understanding of what the different professions do. And also because we all look at things with a slightly different kind of lens or a different perspective, actually sharing that means that we have a really holistic approach to our patients. So we feel that that is a real strength that we learn with and we learn from each other in the school. Over to Sue. Next slide, please.
Just to say on that, from a UPIC perspective, if I may, just to point out, we have 2 foundation programs that lead into various of those degree programs. We have a 3-semester Health and Human Sciences Foundation, which leads into some of the programs you can see there, but also into the university's nursing degrees, and we'll be talking more about those on Friday. And we have a 2-semester foundation in biological and biomedical sciences, which also leads into some of those degree programs. Thanks, Sue.
Yeah, thanks, Tim. So what's really exciting here is if you're somebody that's interested in becoming a health professional, Claire was just talking about the different programs and the different professions that you could be. And I get to talk a little bit about, well, where could you go with this? And what's so exciting about this is literally, as we've said on this slide, it's very diverse. You'd be aware within your own settings, within your own country, within the own context that you're thinking of the diversity of opportunities there. So it's not just working within a hospital context, it could be working more in an outpatient context in a private practice, it could be working in different communities, it could be, so literally you could go anywhere. And I think the most exciting thing is you probably can't even see where you may end up with this opportunity. So you start with UPIC, move on to your degree program, and then that could be it. And you could go off into lots of different areas. And what we do during the program is we obviously work with you to make sure that you've got those amazing skills, the knowledge that you need, the communication skills that, you know, we're going to talk about practice in a minute. But this is then thinking about, that's a springboard for you to go on and do whatever you feel is going to work for you. And a lot of our students will start working in sort of hospital settings to start off with, but I'm aware that there's a lot of people on this call that may be working in different contexts and looking to work in different countries, and therefore the systems, the healthcare systems, might be slightly different to the NHS. But what we're talking about here with these opportunities is that you might not just be working in acute healthcare, so that's for people that are acutely unwell. You might be working more in preventative medicine, so that might be like occupational health, thinking about how you can work with people in their settings, their work settings, to make sure that they don't get injuries. You might be working in education, so there's so many different settings. It just makes it a very exciting place to be. Thanks, Tim. Next slide and over to Claire.
Yeah, so as I say, it's really exciting, and when you do any of the programs that you sit with us, you will have placement opportunities. And one of the things we like to do is get you ready for those placement opportunities. So we actually have a lot of clinical facilities so that you get to prepare in a safe environment before you're going out and actually meeting and treating real people. So about a couple of years ago, we moved into City Place, and you can see quite a few of the pictures from that environment. So that was a newly renovated space on campus, which, as you can see, the university did invest a lot of money into that, and that provides us with dedicated clinical skills teaching. And so we have a huge kind of variety. So you can see, if you look at the picture on the top left, you can see there's a simulated kitchen environment where you might look at how does somebody make a cup of tea when they're struggling with neurological conditions. It also has a bedroom and a living room. So you can think about how somebody manages in their own home and what we might need to do to be able to get them back into home. We've also got some ward environments as well. So again, that when you go into a hospital, it's not like it's the first time that you've actually ever been on a ward. We have a simulated back of an ambulance as well. And again, we've got lots of optometry areas where people will do kind of vision assessments. And actually having all of those clinical skills in one place is really helpful for all of us as different professions. So for example, as physiotherapists, we might be looking at somebody's balance, but we might also be thinking about and working with our optometry colleagues about how maybe visual disturbances might affect that balance. So having those things all in kind of one area really kind of helps us to kind of have that kind of real holistic kind of thinking with regards to our patients. We also have gait labs so that we can assess somebody's walking. We have brand new labs for dietitians as well. And we are building we continue to develop. So we already have a Centre for Eye Care Excellence, and we're actually in the process of building a new, bigger one. So ongoing investment really in the facilities that we have to offer is continuing really. And we think that really kind of enhances your student learning experience. Thank you, Tim. Next slide, please.
Thanks, Claire. You mentioned the Centre for Eye Care Excellence. I can actually look out my window where I am now and I can see that new building. You may be able to hear some sounds from a building site, which is moving ahead at a pace. Also worth pointing out, Intercity Place is a fantastic new building. You may be able to see from that picture, it's actually immediately above the railway station, just across the road from the International College, very close to the university's main campus, which is right in the heart of the city of Plymouth. So all of those locations are extremely convenient, right close to each other.
Yeah,
Thanks, Tim.
absolutely. Yeah.
Oh.
Carry on, Sue.
Yeah, sorry everybody. We get so excited when we start talking about the programmes that we can't help but want to say more. So yeah, thanks Claire, thanks Tim. And it's also worth saying that sort of when you join the UPIC programmes, what we really encourage, and the team at UPIC are really good at doing as well, is for you to come to one of the open days, so that actually you can come, can't you, Tim? I know that that's something that we really sort of encourage your UPIC students to do, to come to one of the open days, so you actually see Intercity Place and you kind of understand. And like you said, it's all so close. So I'm going to talk a little bit about the campus, and Tim, I know that obviously that's something that you'll be talking about as well, because the great advantage of joining UPIC is that you are part of that campus already. But I think the important things to sort of say here is that it is a really thriving campus. A lot of our international students that come on our programs, their feedback is about the fact that it's Plymouth's a great city. It's a really vibrant city, and that campus is very much part of the city and part of the community, and it's somewhere that they feel safe. It is a really thriving student community, and as Claire was saying, there's lots of money being put in. You know, we've got the new facilities at Intercity Place. Tim was talking about being next to the new eye care centre, but there's lots of work going on around the campus. So it is, you know, it's a great campus to be on. And as you would expect, if you are on a university campus, then you get access to the full range of that student experiences, to the Students' Union. And I know a lot of our students really embrace that, because with the Students' Union, as you're, I'm sure, aware, they offer a number of different groups that you could sort of join in. So it might be a new skill, it might be a new sport, it might be something that you want to do, or it might be a group that's actually something that is about connecting with your home country or with other people that come from the community that you are part of. So there's lots of different ways of making sure that your time at university is the best time that it can be, and there's lots of ways that we can support you with that, because that's really important, that we want you to be part of a wider community, not just be part of the, you know, Intercity Place, like Claire's saying, as part of the wider campus. So yeah, the campus facilities are great and all very, very accessible, like literally a few minutes walk. Most of our students with their accommodation, it's a few minutes walk away as well. Tim, we're going to move on to the next slide, please. I'm sure you probably want to say something.
Sorry,
just
to
on
say
that,
before,
and yeah, sorry, Claire.
I was going to say just before we move on the slide, is the link below gives you a bit of a virtual tour. So if you want to have a little look, you can actually kind of get to visualize the campus there. So that link will give you chance to kind of really see what it looks like. Sorry, Tim.
That's all right. Anita, Jake, would you like to say something about our accommodation provision while we're on the topic of the campus and living in Plymouth?
Yes, of course, Tim. I beat Anita to it there. Accommodation. First of all, for the city to live in, it's a really quite it's quite a nice compact city, so it's really good for living close to the university and all your campuses. I think most of our current UPIC students only live about a 5-10 minute walk away from their classes, so that is really good. Another thing about the accommodation is a lot of it. We have a good relationship with a lot of the accommodation providers, such as Clever, CityLets, etc. And it's really quite a good affordable accommodation as well. So you get a lot of good value for what you get.
Thanks, Jake.
We're also keen to talk to you and tell you lots of things, aren't we? This just to say, and this might well have been mentioned before, but as a university, we're really proud that the last round of the Teaching Excellence Framework, we were awarded triple gold. So this is something that gets awarded every 5 years. And that is gold in terms of student experience and student outcomes and student learning. So we're really proud that we have that. And I think that really is a kind of testament to how we work collaboratively with our students to really kind of optimize the student experience that you have. So we very much consistently are listening to our students, getting feedback from our students in how we can further enhance things and develop things, so that we are kind of reflecting a kind of change of times, change of need, to ensure that we kind of retain being able to give you an excellent experience. So yeah, we're really pleased to get that triple gold. The other thing that we have been awarded is about an outstanding contribution to a local community. And certainly within the School of Health Professions, we do feel it's very important to be embedded into our community. So some of the courses, you will do things like maybe some volunteering, or we've recently had a visit to, for our 4th year students, we've had a visit to a local Memory Matters cafe, which is a cafe set up to support people with dementia. We have staff who are also engaging in various projects in terms of maybe giving foot care to homeless people, or singing for wellness is something one of our physio lecturers is involved in. And so that also kind of feeds into the teaching that we give you about that kind of sense of community. So as Sue was kind of saying earlier, it's about realizing that your profession is not just about being in a hospital, but actually you might end up working in a variety of places and actually getting a real kind of sense of the community's kind of needs is really kind of important. So thank you. Over to you, Sue.
Thanks. Sorry, Sue, just to reiterate that, though, it's really important that for any agents on the call, that TEF Gold is a really strong and distinctive feature of Plymouth. And if you're working with other universities, you'll know that that's really quite unusual for not many universities in the UK that have that TEF Gold status. And also from a UPIC point of view, more than 90% of our students progress from a foundation programme to the university's degree. And more than 90% of our students who join UPIC graduate successfully from the university. So every chance of referring successful students to a university with a very strong teaching record.
Thanks, Tim. So I'm going to talk a little bit now about how you learn to become a health professional. And I know, Tim, you'll probably want to say, you will talk about the UPIC programme as well, but I'm going to reinforce here that what we find with our UPIC students is that grounding is really amazing and just makes such a difference. So going to UPIC and getting that understanding in that foundation year really helps then when you step into that BSc learning. And the important thing here to sort of take away is that as a health professional, what we're doing is we are developing your skills to be able to, at the end of your programme, be that independent, autonomous health professional. And that means you can make those decisions about the patient that's there in front of you, that you've got all that knowledge, that understanding, that skills. Remember the slide that Claire was talking about with Intercity Place and the facilities, the amazing facilities that we've got, where you get those hands-on skills in preparation for you to be able to go out into placement and to actually work with your patients, your clients, the communities that you're going to be serving as a health professional. So in order to do that, what do you need to do? So yes, there will be lectures where you learn about certain aspects. So that might be anatomy or conditions or treatment approaches. But the lectures for us are part of the much bigger picture. And there's a few things that are really useful to understand about that. Private study or self-directed studies are a really important part of the programme. So you won't necessarily be told what you need to do every day or what you need to study, because what we'll be supporting you to do is to become that independent learner, so that when you have that lecture that's gone through a particular condition, so this is Parkinson's or anatomy, then you go away and you do that study to really make sure that that learning works for you, that it really sticks, so that you can then apply it to that practical setting. So the lectures sort of then embed that private study. Then seminars are the sort of where you break it down a little bit more. So excuse me, that's where you'll work in small groups to then talk about, so we talked about, for instance, Parkinson's and the presentation that could be. Well, what does that mean in practice, and how would that mean for me? And I didn't quite get how that fitted in. And then sort of in those seminars, it's more of a small group discussion. And then the workshops and the practical skills were where you actually will put it into application. So that will be thinking about, so if you had this scenario with this, if this patient, you were presented with this patient and they had these symptoms, or they were talking about these functional difficulties, or this social situation was the main problem, what would you do? And then you start pulling in that learning that you've had in your lectures, in the seminars, and it starts to make sense. And with those skills, with all of this learning, like Claire was talking about, as well as being sort of your profession specific learning. So if I'm an OT, I need to learn this skill. If I'm a physio, I need to learn this skill. If I'm a dietitian, these are the skills that I need. But also a lot of interprofessional learning, because you know that out there in that healthcare setting, we need to be able to work very closely with other health professionals. So if somebody's admitted onto the wards after they've sort of had a fall, then they're going to be seen by the physio, by the occupational therapist, by the dietitian, by the, so it's all of the team. The paramedic would have been there working in the ambulance with them initially. So it's how do we all work together? We're also really lucky that at Intercity Place, we've got those 2 ward levels. So we can do this clinical simulation. And like as Claire was saying, we can then take it into the home situation. And we've got the ambulance, so the paramedics can be working in the back of the ambulance. So that's how that all fits together. Thanks, Tim. We're going to move on to the next slide now.
I just wonder if, Matthias, at this point, you'd like to say some words about the UPIC teaching style and the way that we teach on the foundation programs.
Yeah, absolutely, Tim. I mean, I think it works off of similar principles in a lot of senses. It's very small groups in UPIC, so you get a huge amount of attention and support, and that's why you can really thrive when you progress on into your undergraduate programs. We start with a grounding of learning skills and digital skills at the start of each program, and that means that you get that kind of underpinning knowledge of how to approach your studies. And then, as you can imagine, depending on your kind of routes through, you'll get different specialist modules. But all the modules are small groups, supportive groups, really good learning culture there. And as Tim mentioned perhaps earlier, our satisfaction surveys, the kind of feedback we get from students is super positive for each module that we do around that. So it's a great preparatory experience for you to progress on to the fantastic degrees at the university.
Thanks, Matthias.
Okay, so we mentioned earlier about how we use our clinical skills labs to really kind of prepare you for when you go out on placement. So in each of the programs that we offer, you will have real clinical and practice environments. So you are going to be working with patients or clients that you'll be treating and assessing as part of that kind of profession. So when you go out on placement, you will have a dedicated supervisor or educator that is there to kind of look after your learning. And so what you will find is, to start with, that you're going to be very much kind of sort of starting to observe and very much supported. We're doing a few things as part of the kind of treatment approach. And then as you progress through your studies, you're going to receive less kind of direct supervision, because when you're getting to the final year, we want to know that you feel confident to be able to go out there and actually kind of practice without sort of supervision. So it's very much a kind of tailored kind of support, with lots at the start, the very first kind of placements you do, and then sort of kind of gradually sort of kind of tailing off as you progress, really. But that experience, it really helps you understand all of the sort of kind of theory that we're talking about in the classroom. So it's very much integrated as part of every course. And we do find that when students come back off placement and they're having a fantastic time, they very much really do kind of feel that they've got really the context to kind of put everything together, really, the theoretical side of things. So yeah, every program that we have, is the curriculum is interwoven with placements.
Have I messed up the slides? I think I might have touched.
You were just trying to put Claire off, I think, Tim, but she did completely ignore that. I love that. Just carried on. And Claire, I just also think what's great to sort of add there was that step up is really important, and just emphasising that that's the whole thing about, like, from UPIC onwards, with all your learning, it's about us supporting you to do that in that right way, and understanding that people do learn sort of at slightly different stages. And that's why there's a lot of university support, wider support to access, learning support, your module leads, your personal tutors. So, we really want to support you as you go through with your learning. And we really recognise that, people are individuals as well. But yeah, Claire, the placements are always the thing that the students get most excited about.
Yeah, I mean, we get very positive feedback from placements, so it's fantastic. Yeah.
Okay, thanks, Tim. On that one, yeah, great. So what we wanted to sort of talk about here as well is about the fact that with health professions, what we all want to do is deliver sort of our health professions care, again, whatever profession that might be, that's the most up-to-date sort of approach. And so we do that by embedding that research within our school. So we talk a lot about evidence-based practice in the health professions. So that's making sure that we're aware of what are the latest guidelines, approaches. You will see on the news all the time about different stories that might come out about this is what we should be doing, or that's what we should be doing. And so what we're really keen to do is make sure we embed that. And what we're incredibly lucky to have is a number of staff that are really passionate and really embedded with their research and doing some fantastic work. We've got a specific facility, so as well as the state-of-art labs that Claire was talking about, and we've got the GATE lab, we've also got a brain injury rehab unit, sort of specifically that looks at research into that area. And as students, you will be directly linking both with the researchers that are doing that, and you might well sort of get be aware of different projects that are happening. With all of our students, you will all be involved in research as part of your pre-registration program, and that's really exciting that you then become part of that. So what that means is that you really understand the research, and then when you go out into practice and you read about it, you've got that much better sort of understanding and ability to embed it into your practice. So all of our students get the opportunity for hands-on research, but you're all working with lecturers that are also part of research as well. And we're really keen as well to disseminate that. So that's why we make sure at conferences we're there and talking about our research and what's happening. And working closely with our clinicians. So this is really important because obviously we just talked about placements. And it's what we've got, what we've developed at the School of Health Professions is a really good collaborative relationship with our placement providers. So whether that's, like we were talking about, could be hospital based, but could be out in the community, could be more charities or other areas. We're working with them as well. So we're very much sort of think of ourselves as in partnership with them, which again just really benefits you as students. We've got lots of PhD students, and that's always growing. So that might be something that, you know, as individuals, you're thinking, well, I might start with a foundation program, might then go on and do a BSc or another program, but then in the future, you could go anywhere. And, you know, there's lots of opportunities for that, which is why we want to develop that real interest in research, in, you know, that evidence, up-to-date evidence-based practice from the beginning. Thanks, Tim.
Thanks, Sue. Thanks, Claire.
Thanks, Claire.
Thank you. So yeah, it's just if we wanted to leave plenty of time for if anybody's got any questions really to ask us. So if you're feeling bashful, we're happy for you to put it in the chat, or feel free to unmute and ask us. Yeah.
Or equally, if you would prefer not to be recorded while you're asking your question, we can stop the recording.
Yeah, I think that sounds like a great idea, Tim, doesn't it? We could.
Should we do that now?
Yeah, we'll do that, and then it's really kind of over to you guys if you've got any questions that you want to ask.
Like Claire said, I think just popping them in the chat is